Welcome to the Diet Doctor News on YouTube. Now, this is sort of a special episode to kind of give a recap of what we've been doing here at Diet Doctor News on YouTube. It started as a project December of 2019, and we've recorded and produced 282 videos, with the goal being to sort of help you understand the science of health and nutrition, present things in sort of a broader context, and help explain them more deeply than just what you get. It's such a muddy water out there. There's so much confusion about health information, especially about nutrition information. So much, bias and confirmation bias and people reporting whatever fits their narrative. In today's nutrition environment that is just full of ultra-processed junk food and full of conflicting messages, there's no wonder why the obesity rates and metabolic health dysfunction rates are just skyrocketing in America and across the world. So we need a place to turn to try and cut through that to help us better understand. And that's what we tried to do here at Diet Doctor News on YouTube. Of course, that's subject to our own bias, but I hope I've done a job to at least help present different viewpoints than maybe what you're getting in the mainstream media, and also more importantly, to help you better understand how to interpret this information. So we're not at the whim of the catchy headlines in the mainstream media. Now, why am I talking about all this? Well, because I think it's helpful to go back and reflect on what we've tried to accomplish, and hopefully what we have accomplished over the past few years in the 282 videos. Some of the big topics we focused on have been red meat. Right? Is red meat as dangerous as everybody says? Well, hopefully in all these videos you've done, you've seen that the risk of red meat is actually very poorly defined, especially for people following an otherwise healthy diet and taking care of themselves, especially within the low-carb diet. We focused on low-carb and keto diets a lot because there's so much misinformation about that. And there's so much strength of evidence about weight loss, about type 2 diabetes management and blood sugar control and prediabetes and even mental health and possible neurologic changes. And we want to be very open about what the evidence shows, where it's strongest, like in weight loss and type 2 diabetes, and where it's emerging, like in mental health and neurologic conditions and PCOS and other places. Now, is it the only diet to accomplish all those things and to help with those things? No, of course not. But it needs to be talked about as a potential example, as a potential option, because there is such good science supporting it. But what about the details of the science? How long does it last? What's the adherence like, right? Those are a lot of the details that we've gone into in these videos. And then what about some of these trials that are, in metabolic wards lasting for 2 weeks, whether they are looking for a metabolic advantage that may or may not exist with ketogenic diets, or whether they're looking at ketogenic diets versus plant-based diets. And what I really tried to bring to your attention is 2 weeks is just wholly inadequate to make that sort of an assessment. It can be interesting, but what it should be doing is informing how to structure longer trials, because I don't care what happens in 2 weeks. I care what happens in 2 months or 2 years, right? So that's a big point I tried to make time and time again. Another big topic has been low-carb diets and cardiovascular risk. We hear so many things about low-carb diets, increased risk of death, increased risk of heart disease, but it's poorly defined low-carb diets and poorly defined increased risk. Whereas if you look at surrogate outcomes from some of the Bret Health trials and other trials with a properly designed low-carb or keto diets, the calculated cardiovascular risk actually goes down. So that's a big point I tried to make time and time again. Also, what's the best treatment for type 2 diabetes? Well, I think we've seen that ketogenic diets probably have the best glycemic control of any diet. So then the question is how to fit into your lifestyle, how to make it work, how to do it safely long-term. And that's where companies like Bret Health have really helped, and how our content at Diet Doctor has really helped guide people. What about dietary adherence? That's a big thing, right? So for those who are having trouble adhering to a low-carb or keto diet, that's where sort of this higher satiety focus can come in and really help people. And then we also talked about time-restricted eating and intermittent fasting, which really has kind of gone through an evolution, right? It was a hot topic, everybody should do it, and then sort of became a little bit more nuanced. Well, you have to be careful about, increasing your calories actually, and increasing your cravings and binge eating and making sure you're getting enough protein. But within that context, time-restricted eating can certainly be helpful for the right person. So hopefully our news stories have sort of helped you through that evolution, at least the scientific evolution of time-restricted eating. So like I said, I hope these videos have served the purpose to educate you about those topics and teach you how to sort of better interpret the headlines around those topics. Now, I also am excited to announce that I'm transitioning to a new initiative called Metabolic Mind, and you can find us at metabolicmind.org or Metabolic Mind channel on YouTube. Now, at the time of this recording, we don't have much there because I'm just getting started. And the push is going to be to focus on the intersection of metabolic health and mental health and how they are very related, and how metabolic therapies such as ketogenic diets and other metabolic therapies can help with mental health. We want to talk about the research. We want to talk about the personal stories and clinical experience and help people understand how metabolic therapies can help with mental therapies, where the evidence stands, and how to sort of help people through this process. So I guess that wraps up the Diet Doctor news here. I'm excited for that initiative, but I'm equally as excited to remain at Diet Doctor as being a member of the board of advisors to really, help Diet Doctor, which I'm excited about their future mission as we're transitioning to higher satiety eating, an eating pattern that can work with any diet, whether it's keto, low carb, plant-based, Mediterranean, carnivore, whatever the case may be. Focusing in on higher satiety eating can be a key that can really help people with long-term adherence to their nutritional program, and therefore improving their metabolic health long-term. So I'm really excited to continue with Diet Doctor as a member of their board of advisors as we go through this exciting new journey. As I said, I hope we served as a scientifically based, reasonable, and practical voice to help you better interpret all this confusing science, all this confusing discussion around nutrition, and not just teaching you about the individual studies and the individual topics, but helping you see how to better interpret things for the future. So thank you so much for your attention. Thank you so much for being part of the Diet Doctor News on YouTube journey. And I look forward to seeing you again, maybe as a different role. Maybe I'll be back as a guest on these videos in the future. So take care, everybody. Take care of yourself, take care of others, and be good. Bye-bye.